Hello and welcome. Today, we'll be discussing a serious and complex condition, brain tumors. We'll explore what they are, what causes them, how they're diagnosed, and what treatment options are available. This information is for educational purposes only and should not be taken as medical advice. Always consult with a qualified healthcare professional for any health concerns. The exact cause of most brain tumors remains unknown, but several factors are thought to increase the risk. These include genetic conditions like neurofibromatosis and Li-Fraumeni syndrome, which are inherited disorders that predispose individuals to tumor development. Exposure to ionizing radiation, such as from previous cancer treatments or environmental sources, is another established risk factor. In rare cases, certain viral infections have also been linked to an increased risk of specific brain tumors. However, for the vast majority of individuals, there's no identifiable cause. Brain tumors disrupt normal brain function in several ways. As a tumor grows, it can directly compress or invade surrounding brain tissue. This compression can damage neurons and interfere with their ability to transmit signals. Additionally, tumors can increase pressure within the skull, a condition known as intracranial pressure. This increased pressure can lead to headaches, nausea, vomiting, and other neurological symptoms. Some tumors also block the flow of cerebrospinal fluid, leading to hydrocephalus, which further elevates intracranial pressure. Finally, tumors can release chemicals that disrupt the normal chemical balance in the brain, leading to seizures and other neurological dysfunction. Brain tumors are relatively rare, accounting for a small percentage of all cancers. Their incidence varies depending on age, race, and geographic location. They can occur at any age, but are more common in children and older adults. Certain types of brain tumors are more prevalent in specific age groups. For example, medulloblastomas are more common in children, while glioblastomas are more common in adults. Overall, the incidence of brain tumors is slightly higher in males than in females. Epidemiological studies are ongoing to better understand the risk factors and trends associated with brain tumor development. The signs and symptoms of a brain tumor can vary widely depending on the tumor's size, location, and growth rate. Common symptoms include persistent headaches, often worse in the morning, seizures, nausea and vomiting, blurred vision or double vision, and weakness or numbness in the arms or legs. Cognitive and behavioral changes, such as memory problems, personality changes, or difficulty concentrating, can also occur. In some cases, the symptoms develop gradually over time, while in others they appear suddenly. It's important to seek medical attention if you experience any new or persistent neurological symptoms. Diagnosing a brain tumor typically involves a combination of neurological examination and imaging studies. A neurological examination assesses your balance, coordination, vision, hearing, and reflexes. Imaging studies, such as MRI, magnetic resonance imaging, and CT, computed tomography scans, are used to visualize the brain and identify any abnormalities. MRI is generally more sensitive than CT for detecting brain tumors. If a tumor is suspected, a biopsy may be performed to obtain a tissue sample for examination under a microscope. The biopsy can be done surgically or through a needle inserted into the brain. Brain tumors are classified according to their cell type, location, and grade. The most common types of brain tumors are gliomas, which arise from glial cells, the supporting cells of the brain. Glioblastomas are the most aggressive type of glioma. Meningiomas arise from the meninges, the membranes that surround the brain and spinal cord. Acoustic neuromas develop on the auditory nerve. Pituitary tumors develop in the pituitary gland. Brain tumors are also graded from I to IV, with grade I being the least aggressive and grade V being the most aggressive. The grade of the tumor helps to predict its growth rate and response to treatment. Treatment and management of brain tumors depend on several factors, including the tumor type, size, location, grade, and the patient's overall health. The primary treatment options include surgery, radiation therapy, and chemotherapy. Surgery is often the first-line treatment for accessible tumors that can be safely removed. Radiation therapy uses high-energy rays to kill tumor cells. Chemotherapy uses drugs to kill cancer cells. Targeted therapy and immunotherapy are also used in some cases. Supportive care, such as medications to control symptoms like seizures and swelling, is also an important part of management. A multidisciplinary team of specialists, including neurosurgeons, oncologists, and radiation oncologists, is typically involved in the care of patients with brain tumors. Currently, there are no proven ways to prevent most brain tumors. However, minimizing exposure to known risk factors, such as ionizing radiation, is advisable. Genetic counseling may be recommended for individuals with a family history of brain tumors or genetic conditions associated with increased risk. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, may also contribute to overall health and potentially reduce the risk of certain cancers. The prognosis for patients with brain tumors varies widely depending on the tumor type, grade, location, and response to treatment. Some brain tumors are curable, while others are not. Recent research advances have led to improved treatment options and survival rates for some types of brain tumors. These advances include the development of targeted therapies that specifically target cancer cells, immunotherapies that boost the body's immune system to fight cancer, and improved surgical techniques. Researchers are also exploring new diagnostic methods, such as liquid biopsies, to detect brain tumors earlier and monitor treatment response. Ongoing research is crucial to further improve the outcomes for patients with brain tumors. Thanks for watching.